coronavirus epidemic?
Mostly reading a lot, um, checking in on friends and family, playing music, um, drawing, learning to play the guitar all over again. So it really hasn't been horrible.
Do you feel directly affected by this epidemic?
I do. Probably not as much as maybe other folks are, but my feeling is if people are affected, I'm affected. It's a communal thing. We all sort of have to get through it together.
It's actually affected it a lot. So I go to the University of Pittsburgh, and my school just recently got shut down for the semester. So starting March 23rd, I'll have to take online classes through an application called Zoom, which will be very difficult considering I'm in my senior year. And a lot of my classes are pretty hard, and I need help from my professors. So I don't really know how that will play out. It also makes it difficult because of the virus, like transportation methods have been canceled. So, like my bus was canceled to go back to school, so I don't have all my books to even like start classes on Monday and stuff. So it's just a lot going on with that.
My husband and I are both physicians, and he's working at an adult hospital. I'm over at Children's. We're only wearing scrubs. We take them off as soon as we get in the house, wash our hands, trying to limit contact. In terms of my daily life, only one of us is going to go to the grocery store at a time to limit exposure. And like today, instead of going to the gym, I went on a run outside and talk or touch nobody. And trying to what's called cohort ourselves. So I'm really only in contact with people who are also in the hospital, and anyone who is off or was on vacation, trying to limit that contact. And then the other thing that we're trying to do is support local business. So we generally don't eat out very often, but trying to do takeout a little bit more because I know that the restaurants are really hurting. So being a little bit more cognizant about that.
Has it affected your work life?
It has. I do a lot of carpentry and construction work, and basically we're not doing much work right now. So just to minimize the spread of it.
Yeah, so I mean, when you look across the board, physicians and healthcare workers are definitely disproportionately exposed, and it makes sense. Fortunately for me and my husband, and it's not the case for everyone, but we're relatively young and healthy and don't have any other risk factors. And fortunately or unfortunately for me, I work in a pediatric hospital, and I've been exposed to the flu, all of the viruses, which I hope will help me. But I'm trying to take precautions to protect myself. Like, yes, we clean our workstations, but I'm being a little bit more meticulous about that, washing hands, and definitely we're being a lot more conservative with the personal protective equipment. Like even more on high alert than usual.
Yeah. The government offered any incentives to your business that you work for?
We haven't actually gotten together to the point where we can do that yet. We're certainly checking the news, trying to keep up on what the government may or may not be doing. So I have a feeling that if need be, we'll probably apply for something along that line.
Well, I think the first thing they could do is figure out a way for the universities to refund students a lot of money, because I know personally, I live in an apartment while I'm at school, but a lot of students live on campus, and they were forced to leave school pretty quickly, so that's kind of concerning for them. It also means that all their money for room, board, and all that stuff will just have gone to waste, and a lot of other fees that we pay, like just little things like going to the gym technically is like there's a fee for that within our tuition already, so just little things like that. I know a lot of students are probably upset about that. As far as what the government could do, I'm not sure what type of action they could take. I don't know how that works logistically. But I think the schools can actually do a much better job of giving students more time to get their things from school and kind of get situated with this whole situation.
What do you feel like you most needed the moment this epidemic became a thing?
Information, mostly just information, trying to sort out news that actually was useful from the news that isn't useful. And, we're all so interconnected these days. You check Facebook, you check Instagram, you get 50 million different ideas about what's going on. So I think information was probably what I felt that I needed the most of right away, right off the bat.
What do you feel like the government could do now to help the communities?
I have a lot of friends in the service industry, quite a sizable amount of people who sort of live paycheck to paycheck, day to day. A lot of folks don't have any sort of insurance, health, or otherwise. So I really feel if we can find $1.5 trillion to dump into the stock markets or the markets. Now, I understand the market sort of has to be propped up. We don't want a total meltdown. But I think really we can find some sort of tax break for the average everyday person, or suspend rent for a couple of months. We can do this. We know how to do this. We have the technology. It's a question of, do we have the will to do it?
Do you feel like the government is doing everything they can to help the hospitals and the local businesses that are being affected by this epidemic?
So, it's hard because if you look at places where government has a lot more control, the outbreak was really contained. So, for example, in Taiwan and some places in Hong Kong, the government downloaded apps on your phone to track movement of people. This really worked from an epidemiologic standpoint, but I think from a personal freedom standpoint and just logistics, that wouldn't work here. It's hard because I do think the government could do more. I think state by state, piece by piece, there are places that are shutting down schools, they're instituting curfews, they're instituting social isolation. And the problem is there's still other neighboring communities that aren't doing that. So you still have the spread. And it's hard because the centralized government doesn't have the power, nor isn't taking this opportunity to do that. In terms of healthcare, I'm sure you've seen the flattening of the curve models. It's not really about limiting the people who get exposed, because if you look at both models, everyone will basically get exposed. It's just limiting the peak and spreading out who gets sick when. Because right now in our hospitals, we have X number of beds, we have X number of doctors, and if everyone gets sick at once, that's what happened in Italy. But if people get sick more slowly over time, then we can prepare a little bit better. So.
What do you think the community can do as a unit together?
Listen to what's coming out of the CDC. Listen to the experts. If they tell us to stay home, stay home. Clearly I'm not home right now, but I came out with my gloves and my face mask. I've got sanitizers. But I think just listen to the experts, and hopefully they'll guide us in the right direction.
You have done personally for yourself to help you during this time?
I've tried to stay in the house as much as I can and limit my interaction. I know they talked about social distancing, so I've just tried to not going out and interact with people that I haven't already interacted with during when the outbreak first started. And I've just been trying to stay up on eating taking my vitamins, things like vitamin C, zinc, things of that nature, and just washing my hands a lot. I know that's kind of weird because people say oh, you guys weren't washing your hands before, but I guess it's just this outbreak is kind of really bringing that to light, how important it is to really wash your hands thoroughly every time, because just touching anything outside can lead to you getting anything, not even just the coronavirus, but just a lot of other things.
That the hospital will be shut down eventually, that the city will actually shut down because of this epidemic?
That the city will shut down? I think so. I think a lot of cities are going that way, like LA, San Francisco, Illinois. I think a lot of businesses are voluntarily shutting down. I think eventually, especially in DC with kind of the demographics, I think people are going to be more willing to give up some of their personal freedoms for the greater good.
Well, I think, it'll be pretty much as normal. mean, those who have will continue to have, and those who are on the borderline struggling will continue to struggle. I mean, that's kind of what we're seeing now. We're seeing the system operate under load, right? So everybody has plenty of happy talk about affordable housing and all the services that are being delivered and how everyone is doing fine. But now you can see, I don't think the virus is a hoax, but the system that we live in and the government that we live under has been operating under a hoax, making us think that everything is moving forward. But really, some people are moving like this while other people are moving like this, and our government is subsidizing that equation. So instead of helping everybody move, we got this going on. So that hasn't changed. The virus is just making it more viewable.
What do you think we as a community can do together?
Yeah.
This virus is happening.
So I think that, social distancing really does help spread the disease. So staying at home when you can, or it doesn't necessarily mean staying in your house, but staying isolated. Instead of going to the gym, going on a run or a walk. Instead of having a big dinner party, calling your friend on Skype, I don't know. And then supporting local business through the ways that we can. So takeout and if you're able to, because I know a lot of people are probably hurting, can't work, may not have the means, and so for the people who can work and are fortunate enough to support those other people.
So can you tell us how you feel taking transit right now?
Well, I don't have to take the transit every day, so I maybe only use it once a week or so anyway. I do my job locally. I do Uber Eats.
So how are you protecting yourself?
Well, I have the glove on, and I just try not to go into, a group of people. The Uber Eats delivery is easy. I just put the food in my bag at the restaurant. I have them put it in the bag, and when I get to the location, I open the bag, and I let the customer take it out so that I don't have to take it out with my hand. I don't have to touch their hand by handing it to them.
I guess your deliveries have definitely increased, right?
I don't know. I took a break yesterday. I want to say Sundays are normally really busy, and I didn't think this Sunday was more busy. I thought it was average or even slow during the day. The evening might have been average.
Hi, my name is Ty. I'm an employee here. The nail salon name is Allure Nail and Bar. We located in 14 in Columbia Heights, northwest, I believe. Yeah. And with us here, it's been effective for a good period of at least 2 weeks now. Ever since then, and we even offer hand sanitizer when a customer come in, and even with masks and stuff like that, and to the point where we run out. So I guess they see that, and then with business and whatever other places closing down. And we forced to close down right now. We're supposed to have 5, but then we haven't done a customer come in at all, and we don't want to waste no electricity. This bill right there, So we try and consume whatever we can. So now we just gotta close,
How do you feel like the government can help these small business owners who have these businesses who have to be shut down right now?
I mean, I just literally signed a petition online for helping others nail salons. We have family in the business who is not just only me, but other I have a lot of friends who is in hairstylists and stuff like that. Right now, it's being affected. You know what I mean? They're going through a tough time too. I don't know how. I wish they can help. That would be nice. You know what I mean? Anything that they can, with the rent or anything that would help us, during this tough time. Anything, I don't know what else that I can ask for.
Do you, aside from your business, do you feel directly affected outside of business?
Yes.
By the epidemic?
Yeah, you mean the home and stuff like that. Yeah, of course. You know what I mean? Everybody we can't even I don't know how to explain it. At home, our families, they have to work from home. Some don't even have a job. Whatever they're working, it's hard. We can't even pay rent right now and stuff like that. I have friends and family who own food hall and stuff in the food industry. It's tough for them.
So the government hasn't offered you guys anything other
No.
than shut down your business?
Yes, correct. They haven't offered us nothing. Not at the moment right now that we know. We heard this and that, but nothing, you know.
What else do you? I heard you say you guys did a petition. Like you guys are doing a petition. Is there something else the community can do with you all so that this helps all the businesses?
Oh man, anything. I mean, together we strong, right? So you know, I mean, any like I asked, like you know, like family, like small businesses and stuff like that. You know, we can all be unite in some type of way. You know what I mean? Like anything, like I told you, you know, whatever it is. Like with me and my family here, we're trying to just. Like, you know, I feel bad for him coming to work, you know what I mean, without making no money. You know, when he have family at home, he can take care, you know, and I appreciate it. It's just more of us trying to see what else we can help around here too, you know, and not just only within us, you know, the better, right, for the community and everything. If I'm doing good, everybody else doing good. So that's all to it, you know.
Is government offering the hospital physicians and workers that work there, the doctors, an incentive while this is happening? No.
So our own hospital is offering some help. So there's like childcare initiatives where the hospital is offering, and I don't know who or how this is happening, but for $10 a day or $5 for a half day for physicians. And then there's certain businesses, so like Pizza actually is offering free pizza for all healthcare workers right now. So that's been really nice. But to be honest, like yes, we're working a lot, but like I have job security. Like I'm working and I'm getting paid, and so I really can't complain. Yeah, but it helps feel supported because I anticipate we're gonna be overworked in the next few weeks.